So I'm Rupesh Bhatt, I'm a consultant urological surgeon and I work at BMI Healthcare. The prostate is a gland that's about the size of a walnut and it sits at the bottom of the bladder. Through it runs a urethra, which is a tube which carries the urine in all men. Its job is to make a thick fluid that contains the sperm. There are three common problems with prostates. They can enlarge, usually with age. You can get prostatitis, which is an inflammation of the prostate, or they can harbour a prostate cancer. So prostate cancer is a cancer of the prostate gland, which is part of the male reproductive system. So who's at risk of prostate cancer? Overall, it's estimated that the lifetime risk of a man in the UK having prostate cancer is in the order of 1 in 8 or 1 in 14. Age is an important risk factor for prostate cancer. We know that 8 in 10 men in their 80s harbour a prostate cancer, but obviously only a small minority of those actually die of prostate cancer. This has led to the notion that prostate cancer is an old man's disease. However, it's important to point out that a quarter of prostate cancers occur in the under 65s. Family history is important and it raises the risk of prostate cancer between 2 and 5-fold. Ethnicity is important, and Black Caribbean and Black Afro-Caribbean men have a 2 to 3 times increased risk of harbouring a prostate cancer compared to their Caucasian counterparts. Well, if you imagine the prostate like an apple lying on its side, the core is the urethra where the urine comes through. Most prostate cancers occur on the periphery, the outside of the prostate, and which is akin to the skin of the apple. Therefore, early prostate cancers have little or no symptoms. Now, this tends to cause anxiety in some patients. Why have I got prostate cancer if I've got no symptoms? But it's important to say that you'd rather pick it up at that stage rather than later when it may have already spread. So the symptoms of growth in a prostate gland are the same whether the growth is because of benign changes or cancerous changes. These symptoms are going for a wee more often during the day or at night, poor flow, a feeling that you've not emptied your bladder once you've had your wee, and what we call urgency, that's having to run to the toilet quickly. So if men notice these symptoms, they should go to their GP. The National Institute of Health and Care Excellence, NICE, has published guidelines for GPs and what to do. Your GP will ask about your symptoms, examine the prostate, and carry out a blood test, the PSA blood test. The PSA blood test can be elevated with an enlarged prostate because of benign changes or prostate cancer. Therefore, if the PSA blood test is borderline elevated, he may repeat it in between 1 and 3 months' time, or if it's grossly abnormal, he'll refer you to a specialist. The specialist will carry out a detailed evaluation, and this may include an MRI scan and prostate biopsies. Early diagnosis and treatment is extremely important. Increased awareness by the population and by doctors has seen a dramatic shift in the disease. Only as far back as the 1980s, half of men who presented to their doctors with prostate cancer presented with prostate cancer that had already spread outside the prostate and therefore was incurable. That figure in 2014 is less than 10%. Better treatments have improved the survival rates in men with both early prostate cancer and, importantly, in men with late or more advanced or castrate-resistant prostate cancer also. These improvements in survival rates have gone hand in hand with improvements in quality of life and decrease in side effects from some of these treatments. So the advice I'd give is don't delay, just go to your GP for further evaluation.